I noticed this in two of these places that I went to. This is where you have your standard primary care physician. It's a general jack of all trades doctor. Visits like $150. This kind of place you go into for like regular checkups and things. If you got insurance or decent money, decent job. This is what you'd call the norm in America. Just a normal, average doctor. So what I discovered, you go into these places, the waits are they're very long. Wait in the waiting room. If you even have an appointment, these days, 2020, you'd be waiting hours to see the actual person. Another new thing to me that I experienced is you go into some of these doctors' offices, doctors' practices, and you have an option to see a nurse instead of a doctor. See, like, okay, my thinking process is more or less old-fashioned and traditional. It's my understanding that, okay, you have a medical practice, a doctor's office, you have a doctor in that place that is like the top guy. Okay, beneath him and working for him, you have several nurses. You have front desk people, technical people, things like that. Well, it's not like that anymore. You go into some of these places in America, and you will have an option, or you will just see a nurse as if you were going to see a doctor in the past. So sitting around in the waiting room of these places for hours, you notice some things. One of the main things that came to my mind is there are no sick people go into these just mainstream average doctors' practices. Very, very few sick people, almost none. What I did see, this is in the waiting room. We'll move on from there. The general lobby waiting area to see the doctor or nurse or whatever. These places, they're filled with people and they're not sick. What they are, this is my observation, most of them are, they're older. They all have insurance. They all have money. They all had good jobs, and they're not sick. And they're there for like regular checkups. And I have family members who are part of this deal, and they go to the doctor like every couple of weeks, and they're not sick. And so it appears that a lot of these mainstream doctors now they fill their schedules. And there's another thing, from doing this stuff so much, I am aware of the fact that these doctors, their schedules are fully booked. They're moving people in and out as fast as possible, all in the interest of making money. And another thing, they choose the patients. The patients come in to see them and stuff. Their patient roster, their itinerary is filled with patients who are not sick. They're just there for regular checkups. They move them in and out, and they collect money very effortlessly. After you wait in the lobby an hour or so, they'll move you back to another waiting area. This is like the small room where the doctor comes in and attends to you. But I spent most of my time waiting in this place, not commencing with the business of the doctor-patient relationship. So the places that I've gone to, the walls are thin. You can hear everything that's going on around you. There's not much privacy. And one of these places I was in, I'll just relate this story. There were like probably 5 or 6 adjacent rooms, like across the hall, immediately through the wall to the left or right of where I was. You could hear all of these exchanges between the doctors and the patients. And I mean, this is what I heard. I sat in this room for like an hour or two waiting. And what I heard was as follows. Okay, I'm sitting there. I'm waiting to see a doctor because I'm waiting to get a diagnosis on a broken skull and a horrific parasite infection that I have. Undiagnosed for 2 years, hospital covered it up. Subordinate attendant doctors to the hospital also engaged in a conspiracy to aid in that cover-up. So I'm sitting here, I'm waiting to be seen because I have a very serious problem. And this is what I heard going on around me. I heard doctors and nurses going in and out of these rooms around me. They go in, lots of small talk, chit chat, talking about vacation, children, they got a new house, all this type of stuff. Lots of small talk, social chit chat. And then when it came time to talk about health matters, there was nothing wrong with these people. They would just come in, the doctors, they'd say, okay, you good to go, see you in 2 weeks. And they were gone, off the hook, they were let go. Very interesting.